This is Into Healing, and I'm your host, Mira Adura. Today's Into Healing guest is Edward Wickwire, a beloved licensed massage therapist. In our conversation, we get into way more than what massage can do for the human body. We discuss society's views on touch, masculinity, and intimacy, as well as reflections on his personal trauma recovery journey. Edward's expertise and brilliance as a practitioner really come through in this expansive conversation. If you enjoyed this episode, please like, subscribe, and follow us for more transformational healing stories. Hi, Edward.
Hi, Mira.
Thank you so much for being here today. I'm so moved to have you here. You've been such an instrumental part of my healing journey, and from the time that I had sciatica and I was pregnant with twins and I couldn't walk to when the catastrophic explosion happened in Beirut in 2020, and I was physically and mentally, emotionally unwell. You've been just such a solid presence, so I'm so grateful to have you here.
You're welcome.
How would you describe what you do?
How I framed it on my bio on my website is that I'm a results-oriented clinical massage therapist, which is true, though what the results are is not something I pretend to be in control of. And there's this simplicity of putting pressure on a person, and that's massage. But then I think for that to be effective, a person needs to be able to relax. And so that leads me to part of my job is to build intimacy and rapport so that a person feels safe, which maybe 15 years ago I would say to the people who I felt like could handle it, that I'm a professional intimist more than I am a massage therapist.
How do you feel what you do supports people's healing journey?
That's another area that's deeply interesting to me because how I facilitate needs to be fluid, essentially infinitely, and dynamic infinitely. And so, in simple terms, I just need to hold space and do my job, which can be reduced down to sort of your structured what happened in the session physically. But I'm also just really holding space and being with a person, which is, in terms of ethical boundaries, for me, the differentiation between I'm not a therapist, but I'm often hanging out in a place that's very tender and very sensitive and very vulnerable. And what, for my purposes, makes that ethically okay is that I'm not trying to accomplish anything. I'm just hanging out with my pal Mira. And if that means hanging out with my pal Mira on an exceptionally bad day, that's what I'm doing. I'm not taking it upon myself to be driving us towards a resolution of something particular. And that informs the whole of what I do. I think the production or the work of clinical massage is what it is, which is supportive and is towards the goal of affecting a physical change in a person's body. But more subtly, what's going on is that I'm showing up with all of that, I call it trifurcated, but all of that complexity and presence, but also the inevitable weird slippy parts of that. And the idea is that in bringing all of that, I'm also creating, in the bigness of that, there is a mirroring invitation for you in all of your bigness to show up in whatever way you want to. And the dream is that you get to show up in grief for Beirut, or in agony from sciatica, or just parking was hard today and I'm kind of crabby. Like we mirror each other, and in that mirroring begin to settle into a rapport that allows for something, for change.
Mm-hmm. Beautiful. What would you say if somebody were to ask you, what does healing mean to you? How would you answer that?
I don't know that subscribe to a model of life in which there is this sort of duality or this binary of healing, not healing, of unhealthy and healthy, because those are inherently subjective states of mind. So I don't know that there's healing. And of course, there are those sort of circumstantial clinical things that we get better from sciatica or a headache or what have you. Those results are ephemeral.
When you say, I don't know if there is healing, can you elaborate on that?
I think what I mean when I say that is that, and this is also part of what I bring to the relationship, is that for me, dismal as it might be, suffering is universal, that trauma is inevitable in life. As a person in a long-term relationship, it is a dark joke between us that best case scenario, I die first, that I won't have to grieve my partner. And that's dismal, but it is also the truth of life. And so healing in the context of the whole thing is dark if you look at it squarely. I think I'm talking about existentialism. How do you have a sense of vigor, of vulnerability, of vitality in relationship to some dismal truths, that the pain of the world is extravagant.
You once told me, we were chatting, and you once said, a first step to healing is slowing down. Can you elaborate a little bit on that?
I think what I meant is that in slowing down, we allow space to feel what we're feeling. And that's an essential component of sort of getting control over our subjective perception of suffering, of pain, of ill health. And so one of the elemental steps in mitigating suffering or illness is slow down, feel your feelings, begin to sort out what can I make changes around, what can I not. The things that I can't, how can I accept them with more ease or more grace? And then built into that, the sort of the resiliency of not doing your due diligence, pick yourself back up. This is life. But it necessitates slow down and feel your feelings, organize yourself.
This is such a big topic, the feeling your feelings, because I feel as a society we're not so good about it, and we're not so good at it. How do we get better at feeling our feelings?
I would say don't trust anyone who has a clean answer to that question. But I don't know if it's, I suspect it's not specific to our society, but it's how...
Well, my society too. I mean, all
I think
society.
This is it. Like,
Yeah,
how do you feel your feelings and still show up and do work? You know, how do you... That an excess of sensitivity or an excess of feeling, I think at the lightest gets in the way of productivity. And so there's this very delicate tension between integrity of sensation of feeling your feelings, and then you also have to work out functional calluses so that the weight of those feelings, of those sensitivities, which I think we all have, don't impede our ability to achieve anything. You know, that as a parent, I really struggle with this one, that yeah, your ice cream fell down and then you fell yourself and skinned your knee, and this is the worst thing that's ever happened, and we should probably just go home because the day is ruined. But maybe it's not. And maybe, and that's true for all of us. I hate my boss. That's okay. Those are valid feelings, but they don't mean you have to quit. And this is why this comes back to participating in the exploration of those sensations and those thoughts, feeling your feelings. It's not for me to captain or assert any control over that, because that's so individual and such a precious thing that people and children need to sort out themselves. And I think that's true culturally. I think currently my Western American culture is really struggling with how do we champion and advocate for people who are marginalized, who have grievances, who have very real feelings and still function. And I'm not competent to speak to that. I don't have an answer beyond, for me, compassion and slow down and share space. And particularly as a middle-aged white American dude, maybe it's not for me to make decisions for other people.
Every time I sit with you, I realize how you have such an awareness. You're just a very aware man. What's the role of awareness in the healing process?
Well, I think we built that into slow down, cultivate awareness, and that idea that there's a tension in maybe all cultures around sensitivity and the accomplishment of anything, productivity. Awareness is critical, but where I, as an individual in my personal work, have had to work to get stronger is that the awareness that I'd like to say you're celebrating comes at the cost of, I am often inert, and I can call it contemplative, but brooding and depressed is also part of who I am, and loving that side of myself, but not being defined by that or limited by that is part of my personal work in getting better.
How have touch and intimacy been part of life since the beginning of time?
Well, I think touch as a form of healing is primate grooming behavior. This is pre-language stuff. And so it is elemental to the human experience. It's elemental to mammalian experience. It is fundamental to everything. And it informs so much of our language and so much of our relationship to the other. And I think it's very easy to lose sight of how profound touch is.
How about intimacy? Or do you think they're connected, the same?
What comes up for me is that intimacy is sort of a conceptual framework around the different forms of touch, that there are forms of touch that can be oppressive, that can be dominating, and that's arguably the opposite of intimacy. That intimacy is, I don't know, tell me what you think, but is intimacy collaborative? It feels like there has to be a give and a take for intimacy to sustain itself. And so maybe intimacy is a way of thinking about creating healing or safe or restorative touch. But I really don't know. That's a super fun question.
How is touch essential to our well-being?
What is well-being is the core of that question to me. That if we accept the premise that touch is elemental and predates probably cognition as we recognize it, then well-being, well, I think we're social animals, and so well-being is the reassurance that we're safe, that we have people, that we're seen, we're literally felt, and there is something fundamentally reassuring in that. And so well-being has to do with the security of knowing I am seen and heard and cared for, and I in turn see and care for others. But I think our culture, and most cultures that come to mind, have varying degrees of it, but it's not essential. But I really like that idea of well-being correlated or associated with health or healing, that those things happen independently, that I can reduce my presence to a simple, commodified, and transactional form of touch that is clinical and no more than that, and that will work. And so this is an area that I get hung up in my sort of constant personal assessment of, is what I'm doing appropriate? Is that I'm, through good intentions, trying to create a bigger space than simply performing clinical techniques, because I believe there is something maybe not essential, but maybe really great about connection with people that is not reductive, but is also not therapy. That is simple, intimate connection.
Can Can you speak to the importance of humility in the work that you do, especially, you briefly just mentioned as a white middle-aged man, what's the role of humility in what you do?
Humility, it has to do with ego, and when I cause harm, when I mess up, it is because I've not corrected for my own ego stuff, and so humility is absolutely critical to ethically interacting in intimacy with another person. But we come back to this idea of how exhausting it is to exist in this ever processing what's happening, what am I trying to have happen, and what is the goal. Humility is the governor over all of that stuff, but an excess of humility, I do nothing. The safest thing is to constrain myself down to zero. That I have been considering the idea that achieving or accomplishing anything in the world involves forward movement, that you are changing position, literally or metaphorically. And I don't think there's any way to change position without risking becoming an imposition, that I am imposing myself on you. And the act of massage is literally, I am imposing my will and my force physically on a vulnerable other person, often a woman. And that's really heady stuff that absolutely profoundly needs humility. But how to do that in humility and still have competency, authority, vision, it necessitates ambition to do the thing. But humility has to dominate everything. And that tension between drive or ambition born of good intention and the governor of humility is super rich.
When you're talking, all I can think of is, wow, I wish there was more people like you who thought so, who think so deeply and so deeply and so thoughtfully about this stuff. Because if we did, we wouldn't have all the stuff we see in the world. Because everywhere I look, there's power over structures, and most of them do not think that intently about their imposing, dominating, But you do.
I appreciate that and I take it on. But also my choices in life mean I live a very small, not like the whole story that my life will tell is one of intimate, small-scale change. And the amount of privilege that I have as who I am and the time that and the place I was born, I have a huge amount of horsepower with which I can affect change in the world. And what if I could do more? And yet that mandate of humility as a dominant theme means I don't do more. And so I'm happy to hear it, but I can you govern? Can you lead a group of people in humility? We tell ourselves a story of that, but I think history is full of leaders who I believe entered leadership with good intention, but lost their connection to humility and that sort of service intent. But I'm also not immune from causing harm, that I'm still a work in progress, and I have hurt people, and I have to own up to my inadequacy in humility. And I also am not doing all that I could. And so I don't know that mine is the answer for everybody.
We all can cause suffering. That's just true of the human condition. There is no perfect being. But I think the more awareness, the more consciousness we bring to everything that we do, hopefully we reduce the harm and we increase the good. And when you say, I do it in a very intimate, small scale, I don't think just because there's things that are big and huge in the world, that's what you need to be doing. I think the impact you make at a small scale is actually quite profound. Anyway,
Although
you're not giving yourself enough credit.
I do believe there is something extraordinary that happens in the connection between us. And that's why that idea of we're co-creating, that we're collaborating in those moments, that healing isn't a function of a thing I'm doing. It's a function of a thing we're doing. And what I do is show up in humility and in good intentions and in a sort of hard-won discipline around self-correcting so that I am closer to clean. But it is so important for me to not adopt a sort of authority over something that is very much an act of co-creation.
Which brings me to my next question. You've compared the relationship that you have with your patients to a first date between two individuals. How is that?
It's tricky to talk about this without tripping alarms. That for me, that almost mystical, that act of co-creation that we're doing is something born of deep connection, and that's the ask with new clients. It's the word in my field. It's not patients. That's a different.
Can you elaborate what you mean by co-creation?
That the ask for people to come in is that we come together in vulnerability and I think that means exposure.
Trust, I think, too.
Yeah, and we're trying to produce a change, and that's super intimate and vulnerable centrally for the person coming to visit me. But for me also, I'm in the mix, which is where the boundaries and the humility and the ethics are so super important, is that the safest answer is that I am only a clinician and I am a cipher to the other. But I'm not. I'm a human being and I'm showing up in vulnerability, not in the guise of the clinician, not in the guise of the mystic or the shaman, but rather I'm just a schlub who's meeting you in this place and we're trying to affect a positive change. And so it's like a first date in that I'm inviting a person into, I have people that I've been seeing regularly for 17 plus years. These are very intense, emotional, deep relationships for me that are far richer than the simple clinical model or the simplicity of I'm a service provider. I've been to weddings and funerals and I've held people while they cry. And so that's the potential, is this ethical, bound, deeply intimate, very profound relationship that encompasses a lot of different roles. And that's sort of the door I'm opening when I meet a person, is to say, you could join me in this. And they have to be entitled or empowered to say, not for me, thank you. And that's super appropriate.
You, when you were talking to me about how you compare what you do to a first date between two individuals, you gave the example of, like, on a first date, you would put maybe your hand on somebody's knee, and then you would kind of see what the reaction is. Can you just share that example here? Because I think it was really, I'd never thought about it that way.
The idea, and it's super important to differentiate romance and sexual relationship from a different, no less passionate, but not sexual, not romantic. But when I am working with a person, whether I've known them for more than a decade or it's a first visit, the session is a constant, often nonverbal boundary probing of, is this okay? Is this okay? Is this okay? And nobody wants to be tasked with reassuring me that this is okay every single time. But I think that's a central dynamo from which the collaborative work of healing is coming from, is is a little boundary pushing and then a pullback when non-verbally or sometimes verbally the recipient, the client, is like, that's too much, and then you back off. And we come back to that beginning of there's a confidence bordering on arrogance that this is the right thing to do, to push into someone's vulnerable spot or to touch their knee and all that might mean for them in terms of boundary crossing. And my job is not to cross or violate boundaries, but to push boundaries and test, is this okay? And to create a rapport or a context in which there is a collaborative surrendering of boundaries. And in that surrendering is where change happens. But the most extraordinary sessions are one in which I am barely cognizant of what's happening. And on the other side, this is part of what's hard about chart noting what happened. And then a bunch of crazy shit happened. I don't know. I just went into the deep water with Mira. I was there, she was there, things happened, it had an effect, but I was not in any way in control of the ship. And I think this is why people cleave towards defining this level of the healing arts in mystical terms, is that there is some extra, in the alchemy of two people co-creating, there is something that is not logical or linear or repeatable, most centrally. And like any successful collaborative meeting, there comes a point at which you're no longer probing and you're getting more into what has been, I think, commodified down into a flow state. But you're swept away and you're no longer two individuals faltering towards connection, but rather there is a connection and there is something extraordinary going on in that connection. And for me, that's as close as I get to a feeling of the divine. That union has had me thinking about communion and what was the intention of the ritual of communion. And if you're in the Christian Western world, you know the story of communion and the Last Supper and all that, which is its own thing. But for me, that idea of there being something extraordinary verging on the mystical in the dance of the transition from wary and my boundaries are high to I have now just cast myself off and I am improvising a duet with a person that I don't really know, but I trust this moment, and that's super rad.
Speak to me a little bit about the mystery.
Can you?
What is mystical in what you do?
I don't have a clean answer, but for me, it does go back to this idea that touch and connection with another person is pre-verbal and pre-cultural, and there is something profound, and slowing down and feeling that is maybe source material for the mystical experience, that a lot of what we create around the mystical experience is around this idea of union and separation and the ache of I need more reassurance than I have in an unsafe world. All of that is, for me, maybe the source material.
Intimacy requires vulnerability, failure, and risk. And in this risk-averse world, how do we go towards more intimacy?
I mean, there's the resiliency necessary of you have to take a shot and stand up and take a risk and accept the consequences that it might not pan out. And so we come back to that idea of feel your feelings, being anxious or reticent to expose yourself. is very understandable, but intimacy necessitates that you feel those feelings, map them, adjust for them, and then expose yourself without imposing yourself. And I think that is essential to any creative experience. In the visual arts, for me, there is something ineffable that I wouldn't pretend I can know every time, but for me, as someone who loves visual art, there is a difference between something that a person produces because they know it's going to be successful and a much more raw and gritty and risky form of art, which is implicitly the stuff I like. But this is a person who's putting skin in the game and big risks, big potential for failure, but sometimes really neat results. And it all comes down to exposure and vulnerability.
You've said to me, sustained intimacy involves resiliency. Can you explain what you mean by that?
I think what I was meaning, and it touches on one of those dismal truths, that intimacy involves exposure or vulnerability. And there will be times when that's bruising. There will be times when one gets it wrong. And the inadequacy of good intentions means that if I'm not operating in a consistently optimized place, I have the capacity to misread a cue, overstep my bounds, and cause harm. And sustained intimacy requires a constructive, affirmative response to those errors, failures, disappointments, heartbreaks. And that's a lot.
Mm-hmm. What have you learned by leaning into your sensitivities as a man?
When I was in my early 20s, my sort of punk rock self-declaration was that I hate everybody. And my job, which was unexpected, I was not called to do this. I just serendipitously stumbled into this career which so fulfills me. But I came to learn it's not that I'm a misanthrope, but rather I am so acutely sensitive, which is to say receptive to people, and I love people so deeply, and I need and want to be cared for so deeply that it was a real transition point that rather than sort of an extrinsic everybody hurts, it is a recognition that I hurt because everybody shines, and I want to know everybody, and that switch was a really powerful thing, which I think might have some metaphorical value down all the way to what is healing. That an affirmative, constructive response to pain might be what healing is. A bad thing happened, but there might be something neat on the other side of feeling your feelings and going into that and testing the thesis that I hate everybody and coming up with, whoa, it's not that. It's something else. Might be pretty good.
You feel you've consistently kind of leaned into the pain and leaned into those things to kind of come out with on the other side?
Consistently is hard to... I do little consistently. I think I'm consistently vulnerable. I'm consistently egotistical. I'm consistently resilient around intimacy and vulnerability, but consistently leaning into pain, maybe so, because I've referenced the word dismal a few times, because there's an awareness that in championing feeling your feelings, I'm often championing that might really be painful to carry the thing around, and often people don't want to hear that. And so I'm trying to, I think, reverse engineering. What is the output that I'm going for when I use a word like dismal to describe my voice? It is this idea that resiliency is critical, and leaning into your sensitivity means you are leaning into your pain, and that's not. Maybe we avoid that more than we should.
You once told me that men neither give enough or get enough hugs, and there's a growth opportunity for them there. Can you elaborate more on that? What do you mean by growth opportunity there?
Well, to touch and be touched is, I think, a growth opportunity for everybody. But
yeah, I'm just thinking about how we just keep reading, article after article about how we're lonelier than ever, we're more depressed than ever, we're more anxious than ever. And I wonder if, touching each other might actually help ease that. And obviously touching each other with all the boundaries and all that stuff and consensual touch and all.
Right.
But I wonder if that might help ease that. I wonder if we've celebrated space and being separate for so long and separated ourselves for so long that now maybe it's created some ailments for us.
I would certainly agree with ailments for us. And in thinking about that, I can't correct for my own bias because I'm so passionate about what I do. But we've taken some pains to map out what I do is not just touch people. It's creating this other space for intimacy that's not limited to touch. And that touch is a part of that. But is not exclusive to that, and that the antidote or the answer might be in cultivating spaces and a cultural shift towards intimacy and resilient vulnerability. Resiliency sort of being code for in vulnerability there will be failures, that there will be pains and triggers and activations, and how do we create unity or union in intimacy, in the potential that you could hurt me and I could hurt you. And again, I don't have an answer.
But that's happening without the vulnerability as well.
Yes.
In society, right? We're hurting people without being vulnerable.
And advocating for and cultivating spaces in which that can be explored. My optimal, the thing that I'm going for with clients in that sort of probing first date sort of thing is fundamentally trying to establish a degree of rapport in which I can trust the other person to say, please stop, you're hurting me. And everybody, literally 100% of the people say, you can count on me, I will self-advocate. It's very hard to say, I hate Thai food on a first date. That we are conditioned to just endure another person's good intentions. And that particularly, I believe, men culturally are cared for by women as a broad monolith, prioritizing our needs over theirs. This is the patriarchy. And I'm really, in my practice, trying to create a rapport in which I can trust someone to step out of their patriarchal conditioning to prioritize my needs over theirs and instead tell me so that I can do better because I can get it wrong.
Oh, that's really big. The patriarchal conditioning.
Yeah. Well, that's, how do we do better? We create safe, cloistered environments to try to unwind some of that conditioning.
Health practitioners and skilled medicine people are generally perceived to be well on their healing journeys and have it all together. What parts of your life and body have you had to heal? It's a juicy one.
Yeah, I reject the premise. I think the commodification of healing, the transactional nature of the relationship, there's a bit of an imperative to present oneself as the paragon of health and healing. And that's part of what I'm trying to do in my practices is to deconstruct that sort of the power differential that is implied with I am the master of all things and follow me, or frame it however you like. There's a biography aspect to that. Would you like to hear some of my story?
Yes, absolutely.
In terms of touch, my father died when I was 4, and I grew up in a grief-struck matriarchy of my mother and my sister, my older sister, who I was 4. So I'm sure existentially there was a sense of loss of father, or loss of man. But I was primarily just in orbit of other people's grief, which was its own thing. And then my mother died when I was 15, which was, she was the orbit, and that was destabilizing, to say the least. And it was a term. The term I'm about to use was one I was really uncomfortable with. But my sister used it to describe herself, and by extension us, an orphan. And that's such a loaded word. It's such an inadequate, an orphan is an inadequate thing. And by this point I was well into my practice, and I was absolutely shrouded in I've got myself sorted. And so I wanted to reject orphan as a term. And often if you want to reject a term like toxic masculinity, orphan, well, maybe there's something in that. And so I've, in the last few years, really been trying to get under and take possession of, that is a truth, that happened. Adolescence was a not great time of finding a place that would take a catastrophically depressed teenager. And then I became a step parent at 22, and my life was defined by parenting more. There are other aches and infirmities. I was born with but I developed significant scoliosis, and so my spine is very curved. My body is distorted in a way that requires a lot of work and maintenance. I am just recovering from a 2-month-long bacterial infection and convalescence in which I was unemployed and effectively inert for 2 months. How I came to massage was I wrote a list of my job experience, and part of that list was I love physical work. I love moving my body, and one of the abiding delights in the work is that my wonky body and my wonky skeleton is consistently being addressed through the work, and I like to believe that there is. I'm not interested. I'm specifically avoidant of the question of metaphysics. It's a neat and interesting subject, but I do not want to speak about metaphysics. But the sense of there is something magical happening when I'm with you or another person in that sort of flow state. I believe, if we accept this more than slightly metaphysical premise, that there's something special happening. There is a physical blowback. There is a healing thing for me as well. And there's a thing called the archetype of the wounded healer that is people who often most need the help gravitate towards these things. And I think I'm a quintessential example of that
it's
archetype.
Fascinating that your scoliosis is actually helped by you helping others.
Or at least I'm consistently invited to be in touch with my body and what is it doing, and it's a career that is slow enough that I can feel myself. I need to feel myself so that I'm sustainably safe. So I don't think it's some magical transmutation of my condition, but rather it's just the water in which we swim, and I am. I don't know that I'm better, though I'm confident I'm better than I would be if I had a desk job.
Mm-hmm. Yeah, for sure. And what has your recent illness kind of, any lessons from that?
I mean, for me, lesson is a word a little like healing, in that it is a product. It is an end of a process, and I generally am more interested in process than I am product or output. But the healing and the convalescence, at the very least and most predictably, there's an increase in my ability to empathize with people who are in a chronic or hopeless or an angry place. Like, that many weeks has been an extraordinary process. And also to feel weak and to feel stuck in an insecurity. I'm so privileged physically. I can take a high strength so deeply for granted, and to not have that was, I'm confident, compassion and empathy enhancing.
How did that feel as a man that has so much of what they do for a living kind of built around their strength?
Terrifying. It was. Also, I'm deeply fed by, in that wounded healer sense. I'm deeply fed by my job, and I deeply love it. And what if I can't do this anymore? Was deeply upsetting. And simultaneously, you and I think I can speak for myself. I'm confident I'm speaking for you as well. Like, it can be okay. If you can't do the thing you love anymore, your job is to find what you do love with what you got. And I'd want to advocate for that. But as a principle, that's well and good. But actually sitting in a space of, like, I might be just chronically broken, accepting that was not pleasant for me.
Yeah, what was that process like?
I got really sad, and I had nothing to do, and it is fundamental to my practice, such as it is, to sit with sadness and observe, like, ooh, I'm really hopeless and sad feeling, and that's interesting. And it was interesting to realize I've been here before. Like, I know this map, and I'd really like to not ever be here, but I'm here. And there's some solace in knowing I can get out of here. I've been here before. This isn't novel. And then I got really angry. And I'm still in an angry place. And that's
Tell me a little bit more about that.
It's would be an expression of the feel your feelings thing, that there aren't a lot of incentives in our culture to own I feel angry, and particularly unrighteously angry at people like my partner, who has cared for me so extravagantly and wonderfully and consistently. And I'm angry at them, and I'm angry at everything. Those are not great feelings, and they're not they're nothing I would want to promote myself with. And yet they are who I am. They're here. And it's my job to try to stay in touch with that and stay in front of that. And that's hard. And mostly it expresses itself in try to not speak with that voice. That voice is okay to have on the inside. Don't let it be an outside voice. Mixed results.
What do you do to move through that anger?
I don't think I do much. I mean, this is central to the voice and my reluctance to address the idea of healing. That my voice professionally is one in which I'm saying, this is ephemeral. It'll get better. And even if the condition doesn't get better, your ability to integrate this will get better. And I have really integrated that. I'm not always good at getting in front of it, but I am really good at understanding this will pass, and there's no reason for me to be aggressive. I'm not great at that.
From working on so many different people's bodies, what would you say the body has taught you?
I mean, at the very rudimentary level, in the beginning, there's all the clinical training that I've had that tells me that this muscle starts here and stops there. But there's genetic, people are different and unique, and what works for one won't work for the next. And so the body teaches that sort of intellectual or academic humility, that the training is important and is what it is, but also people are weird and different and unpredictable, and to work within what is rather than what is supposed to be, or rather than imposing an academic truth on a messy human. There's that aspect of things. What is that? What did bodies? I mean, there's a beautiful paradox in that people are beautiful in their bodies. They're also disgusting in their bodies, and the whole spectrum between. So there's something really wonderful about bodies. But I think also part of the static in my brain as I try to answer that is that I'm not actually interested in bodies that much. Like, I love the interface that the body presents, but I'm not actually very, like, I'm interested in how part A flows with part B.
Yeah, the dance, yeah.
Yeah, and the interrelationships. I'm not interested in specific techniques beyond, is this helping advocate towards flow. And
It seems like everything revolves around this constant movement, constant change, constant
I
movement.
think so, yeah. And that's, like, results-oriented is a stopping point, and I'm not very
There
comfortable
is
with
no
that.
end, yeah.
And simultaneously, I do want to produce results. I do want to be effective and utilitarian, be it in our conversation or with a person. So I am results-oriented in that sense. But I really, what do I take from bodies is it's really just the medium in which the interface and the intimacy and the collaboration towards change happens. But maybe, I mean, it sounds a little lofty or self-celebrating, but I'm as interested in bodies as a painter would be in the canvas. I need it to do what it's supposed to do, but this
You're
is
interested in
just
all the levels.
this is the
Yeah.
stage upon which
Yeah.
the real thing is happening, to mix my artistic metaphors.
It must be emotionally exhausting to hold space for people so much. I mean, all week, right? You're holding space for people. So aside from the physical work, you're also emotionally carrying a lot of people. And on an energetic level, how do you balance that? How do you not take in their stuff? How do you...
That was the scariest part of getting sick, is a 2-month-long illness. There is the extrinsic circumstances of a bacterial infection and antibiotics and a hospital stay. Like, it was an arduous thing, unambiguous biologically. But it is also a thing that I believe it's at least an idea that I have to be engaged with, that if there's any sort of metaphysical, esoteric thing, or even just ego, empathy, compassion fatigue, but if there's a psychosomatic component to this illness, what if it's sort of a clarion call for my boundaries, and my self-care routine is not where I thought it was. And this is it wasn't so much worried about getting sick and staying sick, but rather, what if this is just the beginning of my body beginning to buckle under this more esoteric form of weight that I'm carrying.
Stuff.
And that sort of sin eater, like there's a sort of a historic sociological othering of people in a similar position. The plight of clerics, who so intimately deal with their communities as a religious figure, but they're really isolated in many different cultural expressions of this. Like, it is a known thing that loneliness and other adverse consequences come up. So I don't think I'm crazy for telling myself this story of what might be, and that's still very much in process for me. What if I need to reevaluate my big, messy, open heart?
I just wanted to ask you a little bit about boundaries. What's the importance of boundaries on a healing journey? How important it is to have boundaries, both professionally and in our personal lives?
For me, the idea of boundaries sort of summarizes everything we've been saying in terms of the inadequacy of good intent. That I mean well, so I get to ignore another person's boundaries or become insensitive to another person's boundaries. That's got to be built in. But also boundaries in terms of feel your feelings, but within bounds. If you impose your feelings on everybody around you, you're a liability. And maybe that's appropriate, but get consent if you're going to offload your emotional, your feelings on other people. At least have informed consent, which is another term of art around boundaries, that perceiving where your boundary needs to be, and then advocating for that boundary takes courage, and then being supported by that boundary from the people with whom you're trying to set it. I think boundaries are the fundamental, and to that question, how do we improve the trajectory of men as they grow towards being better, or how do we create safety for women? All of this is about boundaries, and go slow and be able to articulate what you want and be cognizant of what's happening. It's I think the most important thing in our conversation is how interwoven boundaries are into the whole thing. As a practitioner, do I have a healthy and sustainable boundary with what I'm taking in, or am I getting sick all the time? It's super important.
Mm-hmm. How about personally? How important are they in personal relationships?
Everybody says they're good at setting boundaries.
No.
And we are all working at setting healthier, better, more sustainable boundaries for ourselves. And so creating a context, not only where someone will set a boundary with me, but also where we can create the resiliency for when a boundary gets crossed, be it because I was insensitive or because a person didn't know that was their boundary. Like that probing of boundaries is a constant building, deconstruction, evolution, reconstruction of what someone's personal boundaries are. And I think that as a model functions for the people who if it's a fit, if they work with me well and keep coming back, that is one of the benefits that is profoundly healing, I believe, is the ability to trust that I can set boundaries or that I can adjust boundaries. And I don't propose that I, in my office, am the only way that happens, but it is absolutely baked into the process that we are learning how to honor each other's boundaries, how to refine each other's boundaries. And I think that absolutely has applicability outside of clinical body work.
If somebody asked you to explain what a boundary is, what would you say? Like that word, for example, I never grew up around it as a word. It's a word I learned as an adult.
But you did grow up around boundaries.
But I did grow up around it, but I just never knew what it was called.
I mean, boundaries they're not a wall because they have to be fluid, like a membrane. Maybe a membrane's a nice one. My boundaries professionally are very porous. I let people in and I let myself out. It would be easiest for me to be a stainless steel division, but it's not. It's porous like a membrane, which is, I believe, the truth of intimacy is that there's a little bit of you and me and you, and that's how it works. But figuring out what the aperture of the pores are, how much to let in, what's appropriate. Another sort of visual metaphor for me are louvers. You know, that I can let the blast of heat that is my love out, or I could dim it a little bit, and that's so. A boundary is a separation, but it's adjustable, and advocating for that and demonstrating that is the work.
Beautiful. Thank you, Edward. I'm so grateful to you. Thank you so much for coming and having this conversation with me.
You're super welcome.
If you enjoyed this conversation, please like, subscribe, and share with a friend. You can connect with Into Healing on TikTok and Instagram for more inspirational and behind-the-scenes content, and visit our website, intohealing.com, for transcripts and other goodies. Into Healing is made possible thanks to people like you. Contributions made through Venmo @IntoHealing or through our website, intohealing.com, help us bring you more inspiring episodes. This has been Into Healing with Mira Adura. Thank you for joining us.